Hello everyone. This is Dr. Pratibha Shrestha, and I'm currently working on Washington University School of Medicine as a postdoctoral research associate. And today I'm going to talk about my research work during my PhD in Louisiana State University Health Science Center. And the topic is distance to radiation treatment facilities affect surgical choices among women with early stage breast cancer by their age at diagnosis. So we all know that breast cancer is the most common diagnosed cancer and the second leading cause of cancer death in American women. There are many factors that affect the treatment choices among women, and distance is one of the most influential non-clinical factors in receiving mastectomy. So, besides the distance to RTF, the age of women might also influence surgery choices as younger women are more likely to undergo mastectomy for an aggressive breast cancer, and due to fear of recurrence, if they might choose breast conserving therapy to preserve the breast in case of less aggressive breast cancer. However, older women may undergo mastectomy regardless of aggressiveness because they are more likely to have driving constraints, experience more chronic illnesses, and live in more rural areas compared to younger women. Thus, age may have a moderate relation of distance to RTF with surgery treatment. And as we know, treatment decision making is a complicated process. So some non-clinical factor that is distance may prevent breast cancer women from choosing optimal treatment. So to receive a post-surgical radiation therapy, a woman must commute between a home and the radiation facility every day for 4 to 6 weeks after breast conserving surgery, which may be difficult. Therefore, for those without transportation, it may become a major barrier, as well as there are no prior studies done to assess the moderation effect of age in the association of distance to RTF with surgery choices when we are doing this research. Thus, the hypothesis of our research is to the distance from home to radiation therapy facilities affects the choice of breast conserving therapy more among older or stage breast cancer women than younger women. So this is the conceptual framework for our research. Here we see the uh, moderate effect of age in the association of distance to RTF with the surgery choices while adjusting for the other covariates. Methods and materials. So the data were from the population-based Louisiana Tumor Registry, and the eligibility criteria were Louisiana women diagnosed with stage 0 to 2 breast cancer in 2013 to 17, who received either breast conserving therapy or mastectomy. Further, unknown cases of race, poverty, urbanization, outer body outlier like body weight or height were excluded, and the outcome variable is the surgery with like either mastectomy or breast conserving therapy based on their surgical code. And the primary interest of actual exposure was distance to radiation therapy facilities, which was classified as the nearest radiation therapy facilities or nearest accessible radiation therapy facilities. The nearest radiation therapy facilities is the closest to patient's home, regardless of whether owned by government or private, and the nearest accessible RTF was determined based on the patient's health insurance. The distance measured by miles was categorized into four categories: less than or equal to 5 miles, 5 greater than 5 miles to less than 15 miles, greater than or equal to 15 miles to less than 40 miles, or greater than equal to 40 miles. So the covariates that were adjusted for our research is age, race, diagnosis year, BMI, poverty, rural urban status, insurance status and diagnosis, comorbidity score, and then AGC stage, and then subtype of hormone receptor and HER2 type. And the statistical analysis, for that, we did the descriptive statistical analysis, chi-square test, were performed by the type of surgery received, and the logistic regression include both univariate model and the multivariable model to assess the association between distance to RTF with surgery choices by calculating the odds ratio and 95% confidence interval. And the interaction term was created by recategorizing age group into younger women aged less than 65 years old and the older women aged greater than or equal to 65 years as well as we recategorize the distance into three groups, that is less than 15 miles, 15 to 40 miles, and greater than 40 miles. And all the data analysis we perform using SAS 9.4. So the results here, this is the table 1, which shows the prescriptive statistic and of 11,604 women with early stage breast cancer. Almost 2/5 of the patients were age 65 and older, and the majority of patients were white, that is 69%. And here we can see that most of them were privately insured, 51.6%, and most of them were living in urban areas, that is 77.2%. And majority of the women were overweight or obese, almost 68%, and patients with HR positive and HER2 negative breast cancer accounted for majority of cases, that is 58.9%, and triple negative breast cancer accounts for 11.6% of the cases. As well as more than 80% of breast cancer women did not have comorbidities, that is 81.3% in accurate, and almost half of the patients resided within 5 miles from the nearest accessible RTF and 46.7% from the nearest accessible RTF. So table 2 shows the association of distance to RTF with surgery choices. And here, overall 46.7% patients received mastectomy and 53.3% received breast conserving therapy, and compared with distance less than 5 miles to the nearest RTF, like higher odds of mastectomy were observed for the distance 15 to 40 miles, and that is 20% higher, and greater than 40 miles, that is 56% higher. And similarly, those with distance greater than 15 to 40 miles and greater than 40 miles to the nearest accessible RTF also had higher odds of mastectomy, that is 22% higher and 48% higher compared to less than 5 miles distance to the nearest accessible RTF. And beside that, in the unadjusted model, younger age, high poverty area, Medicaid insured, women resided in rural areas, underweight, stage 2, and the HR negative and HER2 positive, tumor and comorbidity score greater than 2 predicted higher odds of mastectomy than their corresponding counterparts. And table 3 is the adjusted model which shows the association of distance to RTF with surgery type. And after adjusting for covariates, the odds of mastectomy were higher for patients traveling 15 to 40 miles and greater than 40 miles compared to less than 5 miles. That is 70% higher and 39% higher for to the distance nearest RTF, and similarly, further, patients with greater than 40 miles to the nearest RTF has 39% higher odds of mastectomy than those with less than 5 miles. And similarly, those with greater than 40 miles distance to the nearest accessible RTF had 25% higher odds of mastectomy than those with less than 5 miles. However, compared with patients less than 5 miles, the odds of mastectomy were not significantly higher for those with 5 to 15 miles to the nearest RTF as well as to the nearest accessible RTF. And figure one, the association of distance to RDF, with the breast cancer treatment by age group. Here, the figure shows the interaction effect of age in the association of distance to RDF with surgery choices. For patients age greater than 65 years, compared with distance 15 less than 50 miles or 15 to 40 miles to the nearest accessible RDF, the distance greater than 40 miles had 97% and 51% higher odds of mastectomy after adjusting for other covariates. And similarly, while in contrast, for patients aged less than 65 years, the association of distance to nearest accessible RDF was not statistically significant. And similarly, for distance to the nearest RDF, the odds of mastectomy were higher for older women aged greater than 65 years with increase in distance to RDF. In contrast, for patient aged less than 65 years, the association of distance to nearest RDF was not statistically significant. So the conclusion of our research is distance to the nearest or the nearest radiation therapy facilities influence the type of surgery received, especially among women in Louisiana greater than 65 years with early stage breast cancer and who are eligible for breast conserving therapy. With the increase in distance to radiation therapy facilities, women aged greater than 65 years are more likely to receive mastectomy. This highlights the importance of transportation barriers for getting optimum breast cancer treatment in older women. So to increase the receipt of breast conserving therapy, target intervention to overcome the transportation barrier is essential, as well as future studies are encouraged to consider the accessibility of patients to radiation therapy and distance-based interactions to have precise results. And the strength of our study is the comprehensive population-based enriched data from the Louisiana Tumor Registry, and distance to RDF is based on facility and residential address, not on the zip code center point. Therefore, they are more accurate. And the interaction effect of age and distance regarding the surgery received, either mastectomy or breast conserving therapy, was also one of the unique findings of this research, and which would be helpful to healthcare professionals or providers or policymakers to develop the effective intervention to achieve quality care for old early stage breast cancer patients. And there are limitations for our research. That is the details about other decision influencing factors that determine the choice of surgery for women with early stage breast cancer, such as individual belief for choosing mastectomy to avoid radiation, or choosing breast conserving therapy to have minor surgery, or having a history of breast cancer in family and individual surgeon practice was not collected, as well as the assumption made that not all private RTF accept Medicaid or uninsured patients, but these patients have access to all public RTF might not be 100% correct in some cases. So the public health implication and future direction for our research is women with early stage breast cancer should be encouraged to consider a breast conserving therapy whenever possible by providing all the required information from the physician while making a shared decision, as well as the target intervention to help older women to overcome the transportation barriers may increase the uptake of breast conserving therapy, as well as investigating the influence of individual behavior, physician factors, healthcare access, social support on breast cancer surgery choices, and survival is also important. Thank you for listening. Any questions? Please let me know.